Yeah, you're gonna want to stand on that side. All right, well, welcome everybody to DMARC and to our Portrait of a Pantry Visitor report, which we affectionately refer to as 3D report, data, demographics, and disparities. I also think it's interesting to think about 3D and how when we see things in 3D, we get a little bit different view of things. That's really kind of the point of what we're trying to do here, diving into some of the information behind what is driving folks having to come to pantries in the first place, and understanding some of their circumstances and their challenges. So thank you for being here today to explore this with us. So I think most of you are probably familiar with us, but just to kind of level set, the biggest piece of our work here at DMARC is our Food Pantry Network, which has been in operation almost 50 years now. It's made up of 14 permanently placed pantries. We also have a mobile pantry program and a home delivery program. And it's really built on 3 pillars. The first pillar is providing a dignified experience as close to grocery shopping as we can make it. The second is providing healthy food items so that we're not complicating any of the health issues or concerns that folks are facing. And the third is a commitment to collecting data. And really, I think this event today is a testament to why collecting that data is so important. Just to kind of let everybody know, nobody has to answer any of the questions we ask to be able to get food, but most of them are happy to do so. So we've built a relationship of trust. They understand how we use that information and why we use that information to try and help change circumstances, systems, and make changes across our community and state that really will help lift people up and put them in a better situation for themselves. So this has been a pretty extraordinary year in fiscal year 24. A lot of broken records, as you'll see, but it's only due to an extraordinary effort from this community, from staff and volunteers across not just our food pantry network, but food pantries across the state. You're going to see a lot of data today that is coming from those 14 pantries or mobiles that I mentioned a moment ago. But a lot of this same information is happening everywhere across the state. I think there's sort of a misconception sometimes that food insecurity is an urban problem. It's not, it's a statewide problem. We got Michelle here in the back of the room. She can tell you about their 700 partners across the state are going to be facing a lot of the same challenges, seeing a lot of the same rises in need as we're seeing here in the metro. So this chart shows you sort of our year over year service, and you can see it's been steady growth. There's been a little dip, that blue line dip comes in where the pandemic came and we suddenly had more support services available than we ever had before. It's amazing to see what happens when programs are funded at a level that actually can get people to a sustainable place where they don't need food pantries. But really, since the end of those programs in 22, everything has just continued to rise. And I think the startling thing about this graph specifically is the huge wide gap between this year and the previous years, when we've never experienced growth this wide in a year over year scenario. What's busy is starting to look different. We had our almost ridiculous average of almost 1,200 people per day. Days getting over 1,000 used to be a big deal for us. The most startling statistic to me is when we start looking at people who are coming to a pantry for the first time. For 27 of the last 28 months, we've broken that month's record for the most first-time visitors in that month's history. So for 2 years running, and the 1 month that didn't break it, missed it by like 20 people. There has to be a ceiling to these first-time visitors, but we have not approached it yet. And it's been regularly over 2,000 individuals a month that are in that first-time visitor category. And that's looking at data going back 12 years. So it's really, we're going to try and dive into some of what we see specifically with first-time visitors today. So stay tuned for some more on that. But you can see a little bit of just the days at these high rates that we just haven't experienced. 5 busiest months we've ever had have been in the last 12 months. We just had our busiest single day ever earlier this month on the 3rd, when nearly 2,400 people got assistance in 1 day across our network. And you see on the side, the first 7 open days averaged over 50. That actually went into the middle of the month. So for the first 2 weeks of September, we were averaging over 1,500 individuals assisted a day. We've been coming up with this new acronym, BOAT, busiest of all time, because we keep saying it so often. I'm also a little worried that it's becoming normal and that people are starting to think, well, this is what food security is, and these are just what we should expect these numbers to be. That is not the case. This is sort of at a crisis level, and we need to talk about it like it's at a crisis level, because numbers like this are ridiculous. So in addition to all the challenges that pantry visitors are facing, in addition to, some of the just nonprofit sector-wide issues with sort of dwindling money available for all the good work that's being done out there, we've also really this year faced some challenges with our government. I'm sure most people in this room are familiar with the summer EBT money that we continue to refuse to accept. Any other investment in the world where you could put up $2 or $3 million and get $29 or $30 million back, we would do in a second. So making decisions like that is not helpful towards solving this problem. We have SNAP enrollment at a 16-year low, even though we have food insecurity as high as we've ever seen it. We're not making enough efforts to make that a program that people should feel okay to use. We continue to still demonize it and demonize people who might find themselves in need of that program. There's a lot more we could probably be doing with outreach collectively as a community, and just more that needs to be done, because this is not an issue that can be solved by any 2 sectors alone. This is very much an it takes a village sort of situation. We need a strong effort from the government. We need a strong effort from the private sector, and we're doing everything we can in the nonprofit sector to do our part as well. But if we aren't all making an effort, this problem does not get better. So we call this event Portrait of a Pantry Visitor, and really the most common question we're asked pretty frequently is, so what does a typical pantry visitor look like? And there really is no typical. We'll go through sort of, here's what the averages are across the different questions, the different demographics that we ask people about. But this is an everyone sort of scenario. This is an every person is the poster person for this issue. There's a lot of disparities and systemic issues that have been put in place and have stayed in place, and really work been done to keep them in place. That has really continued to drive this issue and continue to push more people into food insecurity. And unless we can come up with partnerships and ways to break some of those down and change some of those systems, again, this is not a problem that we will solve. So we try to highlight some of those disparities that we see with the data that we have compared to what our community makeups look like. And we'll go over some of that information with you today too. Do want to make a land acknowledgement, and we do this as a part of this every year, and I'm just going to read this aloud. We acknowledge that we are located on the ancestral land and territories of the Makoji or Iowa, Sac, and Squaxin Fox peoples. This land was taken by force and coercion of white colonizers and the government of the United States. We wish to pay respect to elders of the past, the over 1,000 Native Americans currently residing in our community, and future generations. And with that, I'm going to hand things over to Blake, who will go over some top level data with you, and then we're going to have a panel with some folks to dive into some of these different groups a little bit more and understand some of the challenges and barriers they're facing.
Great, thank you, Matt. For those of you that don't know me, my name is Blake Willits. I'm our marketing communications manager here at DMARC and joined the team just after the start of 2023. It's been an extremely challenging and extremely busy time since I joined the staff, as you might have recalled. But I think just a little quick editor's note before we really jump into things. For these numbers, I'm going to put one more big number out there for you, just so we can keep that in the back of our minds for looking at all this. All right, folks online, we're at 70,727 unique individuals who at some point during the last 12-month period we're looking at with this data utilized a DMARC Food Pantry. So that's only those 14 sites in our mobile program and our sites that go out in the community. But, you know, the need is much greater than even this number, let alone, and we're sort of dissecting what works with each of those demographic groups and how this is happening at a city level. Just keep that number in the back of your head. So one of the biggest things that we found from this report year after year is that the disparities that have been found in our community for decades continue to have a profound effect on how people utilize food pantries and who is coming to our pantries. And so the challenges that we're facing in this moment now is that as more and more people continue to visit a food pantry, that's going to expand on those disparities. More and more folks were living at that edge of I was able to meet my needs, I was able to pay my bills beforehand, and I'm challenged to do that now in a way that I wasn't before, are being pushed over the edge and having to seek out supports like. So this is just a look at overall, what are the demographics last year compared to this year, fiscal year data. And you'll see that one of the biggest shifts is as time goes on and we've had such a challenging year, there are more folks from our crowd that's coming to the food pantries continues to be more and more diverse and less white. And again, backing up that challenge that we're seeing with as time goes on and more folks are coming, the more challenges we're facing in that space. Now, this is just a look at DMARC visitors overall compared to who are those folks who are visiting a food pantry for the first time in the last 12 months. What we call our new food pantry visitors throughout the course of this report. And even more so, you know, that crowd continues to be less and less white. This is a challenge for every single community in our neck of the woods, in the Des Moines metro area here. So this is just showing us zip codes, you know, a lot of areas where we've historically seen more folks. We continue to see lots of people, but the 54% of all folks who are coming to a DMARC pantry are from these 6 zip codes. So there are areas where we're focusing our concentration on where the need is. We can continue to do that in a better and smarter way in those areas. But one thing I really want to point out, and that is always shown, is that in our suburban communities, even though the numbers may not be as high as what we see in the city of Des Moines here, the challenges and the disparities we're seeing are right on par. And that's across the board. So this is a look at just Des Moines, 48,000, roughly 48,500 people living in the city of Des Moines utilize the DMARC Food Pantry. Now, that makes up roughly about 23% of the folks who live in the city of Des Moines. And, you know, these demographics that you're seeing on the pie chart look awfully similar to what we see for the overall. Now, if you look at just the general population, so who lives in the city of Des Moines here, about 66% white non-Hispanic. So again, those disparities that are pushing people to our food pantries continue to expand. This is a look at Ankeny. Again, all of our suburban communities are going to find this, but it is really shocking when you lay it out like this, just how big of a difference it is of who's visiting our food pantries versus who actually lives in these communities. Again, 90% white in the city of Ankeny. That's overall about 7% of the people living in Ankeny actually visit a DMARC food pantry. So it's, you know, a very small subset of our community if you look at the big pie, but again, the challenge is how can we meet the need of those folks? This is Clyde, again, 83% white, about 34% of the folks who are visiting. Just over, just short of 2,000 people overall. Johnston, pretty similar, again, 86% white, 37%. It's happening in every single community here in the Des Moines Metro. All of our suburbs, West Des Moines here. Now, again, Matt mentioned the typical food pantry visitor. There is no typical, but one of the things that we continue to see year after year is those categories, when we break it down by socioeconomic status, who's visiting, how often they're visiting, all continue to be the same since we started doing this report in 2021. Again, the trends, they just continue to expand. So who is that typical person? If you're going to picture somebody, it's probably someone who's a white, non-Hispanic woman who's graduated high school, does not receive SNAP benefits, has one kid living below the poverty line, and only visits food pantry once or twice during the year. There's a lot of myths, misconceptions about who it is visiting the food pantries. I'm sure all of you are hearing a lot of these same myths and challenges in your community in the work that you're doing. About 40% overall are white and 53% are women, and 36% were actively enrolled in SNAP. One thing I'll point out, Luke, who will be speaking later, will talk a little bit more about this, but virtually everybody who is coming to a DMARC food pantry is income eligible for SNAP, but 36% are actually enrolled in the program. Now, some other things that we continue to see, again, year after year in doing this, nearly 3 out of 4 people who live in the Des Moines metro area who are utilizing a pantry are below the federal poverty line. Now, that's a tricky number. I know we all kind of understand communicating what the federal poverty line can look like and what that actually means is a challenge, but in the scope of what we see in our food pantries, especially when you look at the relationship between SNAP and between other federal programs, and you know why people are coming to a pantry versus why you are or aren't using those programs, or why you're coming at all. This paints a pretty good picture. This is one of my favorite graphs of this report, and every year it's a very important piece in telling the story about employment and who it is that's actually coming to our pantries. Now, overall, the vast majority of folks who are visiting a DMARC pantry are not unemployed. This is just breaking it down, you know, about a little over 1 in 3 are under the age of 18. It is extremely important in the food that we offer, in the way that we offer it, that we try and cater to families. And as you can see there, only about 19% are in that working age, not actively employed, or sorry, unemployed. And there's a little bit of a divide when you look at just based on gender, how that changes the older you get. So we'll see that gender divide expands the older the food pantry visitor typically is. And a lot of the challenges around that is just sometimes older seniors who are men, it's harder for us to reach them in these programs. It's harder for us to convince them to ask for help. And just generally, this is just something that we've seen as a pattern over the years. Another thing that we hear a lot, people are overutilizing this system, overutilizing these pantries, coming 12 months out of the year all the time. That simply is not true. About half of the folks who are visiting only come once or twice during the year. A lot of times it's a matter of I lost a job, I've experienced some kind of financial hardship, or I've just been knocked off my feet temporarily, and then we never see them again. Or it's just a matter of I need a little extra help to get through this month, these couple of weeks. And when you look at this graph, again, you can see as that trend goes down, this is just number of months, how often people are utilizing it, about 46% are just not once or twice a year. So this report, and we remind people of this every year, this is an invitation for all of you sitting out here to take this challenge to work and find somebody who's sitting to your left or your right. You can try and find an area where your work intersects with the work of another organization, with another group, and find some of these areas where we can take this data and put it into action. It's a roadmap. These 4 areas, partnerships, advocacy, further research, and our services are where we've really spotlighted as to where those bumps along the road in what could be those solutions to help us better meet the people where they're at in our community and better serve them. But I think the biggest thing when we look at just our services in general and what we're seeing here broadly and who that typical food pantry visitor is, the more we can do to preserve people's time who are in these challenges where they're facing poverty, the better we're able to serve them. And whether it's putting people within our food pantries who can help them navigate these systems, this red tape that you have to enroll in some of these programs or figure out what's available, and providing spaces where more and more navigators are together and more agencies are under one roof is going to make a huge difference. So that's kind of our area of focus moving forward. But for those first-time visitors, who might be that person visiting a food pantry for the first time in this past 12 months? I'm sure you all are very familiar of what's going on in the grocery store, of the drop-off in some of these federal programs and other resources that were available in our community during the pandemic that are no longer available. Those are really the 2 big things that seem to have pushed about 1 in 3 of those folks who are visiting a DMARC pantry to come for the first time. But broadly, what we're seeing is just compared to who that average food pantry visitor is, they're a little bit younger. They live in smaller household sizes. They're just as likely to be a man or a woman as far as what they reported with their gender. And they're more likely to be Hispanic, more likely to be living at or below the federal poverty line, more or less likely to utilize SNAP. So a lot of this just really points to the fact that we have some folks who are on the edges of federal poverty line there, but many of the folks who are coming to us for the first time are doing so in a way that they're trying to just address that temporary need that's come about in this last 12 months. And a lot of the disparities that we're seeing across the community are just expanded when we look at who those folks are who are coming for the first time. I like to point out what we see in some of the other reports in our community and probably the other data and research that's being done. And Alice is a perfect example of that. So the United Way report that's released every year points out that we're just continuing to see a large stretch and expansion in the number of people who are sitting in that space where they're actively working and employed, but they're not able to meet their basic needs. And so that's who Alice is, just in a nutshell. And this is broadly what we're looking at, just folks here in Polk County, who's living in that range, who is in that situation where they're facing some higher poverty, below federal poverty line. And then, the challenges that we're facing with these new visitors is a lot of what we've seen just broadly across the board, but there's some specific things we can be doing as far as targeting our outreach to some of those communities who are more likely to be visiting for the first time, doing some more work to eliminate barriers with some of the federal assistance programs that we know make a huge difference for these folks, whether it's SNAP, WIC, other things that are available in our community, specifically here in the Des Moines metro area. And just continuing to do more research. I think that there's a lot of opportunity for us to better understand not only who these new visitors are, but folks who are coming 12 months or 11 months out of the year, who are living on disability, and who are facing these challenges day after day after day. I'm going to go ahead and pass it over to my friend here, Luke Elzinga. He is our policy and advocacy manager at DMARC, been with us for many years, and he's going to talk a little bit more about SNAP and the relationship with our families.
Yeah, thank you, Blake. My name is Luke Elzinga. I'm the policy and advocacy manager. And we wanted to expand the report a little bit this year to kind of look at that connection between SNAP and food pantry use. And so we put in a data request with the state for SNAP use in Polk County for the same period of time that we're looking at our numbers for. And we learned that in Polk County, there were 131 unique individuals from 62,000 households who were enrolled in SNAP at some point in that fiscal year. Now, usually on a given month, it's around 55,000 people are enrolled. So this was some really useful data that we hadn't seen before. Over half of them were children or seniors. Women rely on SNAP more than men, and the average household size was 2.1 individuals. We also asked some questions about average benefit amounts. And we knew what the average is. It's about $323 per household. But we didn't know how many people get the minimum, how many people get the maximum, how many fall in between. The minimum benefit amount in I was $23 a month per household, and the maximum depends on your household size. So for a single person, I think it's around 275, and it goes up from there. People who have very little to no income are the people receiving that maximum benefit. So this is also really useful information. We know 30% of the people receiving SNAP get that maximum benefit, only 4% get the minimum, and about 2/3 are falling somewhere in between. And during the pandemic, if you recall, through emergency allotments, everyone started receiving the maximum benefit. This data is really helpful to know too, of how many people that assisted when that expansion happened. We also wanted to look at average length of duration of whether that's pantry visits or receiving SNAP. And so again, for the same time period, we asked the question, what is the number of months people have been enrolled in? And so you'll see on the left side, there's some higher numbers, big peak at 6 months. And that's when a lot of recertifications happen.
Now, I was going to ask, when you get approved for SNAP, how long is that certification?
For the typical household, it's 6 months that you're then being asked to recertify. And so we just got this data fairly recently, but I think this has some very good questions for us to follow up on, because only about 1/3 of everyone who received SNAP received it more than 6 months. So most people were seeing this drop off at the 6-month time period, which is also when people are due to recertify. So I think we have more questions than answers at this point, but you can kind of see the comparison between visits to DMARC and length of participation. And I think for both, the same is true, that there's some people who this is a temporary support, that they're just needing it for a few months to get back on their feet. And there's some people, a smaller group, that are benefiting, they're receiving SNAP multiple years, they're going to the pantry every month. That's a much smaller population than the number of people who are being assisted in a more temporary fashion. So this is a graph going back to 1976, and it is total pantry services. So it's not unique individuals, it's a repeat number. But there's some clear points in our history where you see the connection between SNAP and food pantries. So in 2013, you'll notice we started seeing some really big increases in use. Well, at that point, that was when some additional benefits from the American Recovery and Reinvestment Act had gone away. SNAP benefits were decreased. There were also some other changes. I will also just note in the kind of 2016 time span, there were things we were doing as DMARC to expand our services. So I think that's an important thing to note too. But we really saw some drastic increases. And this is when we started getting more involved in advocacy work. You can see this divot on the right side here too, when we had emergency allotments going out in the state. And people were receiving the maximum SNAP benefit. So some people went from receiving $20 a month to $250 a month. Others, it was some range in there. But when those went away in April of 2022, that's when we started seeing some really dramatic increases at the food pantries. And that's what we had been warning about during the pandemic, is that when these temporary programs went away, we were going to see some really big numbers. That's exactly what happened. Another graph that I want you to try and focus on the blue line first, because I know there's a lot going on there. But the blue line is the unique individuals assisted by DMARC. And you can see some kind of annual trends. You'll see some kind of peaks. Those are November, which is typically the busiest month at food pantries. But you can see at the start of 2020, our monthly numbers were almost half. And this axis doesn't go all the way down to 0, but we saw some really big decreases in our numbers. And then you can also see when maximum benefits went away, how those numbers shot right back up. That green line is the total amount of SNAP benefits being distributed in Polk County. And the reason why we use total amount of benefits is that factors for individuals and an increase. So some areas of opportunity here, doing more partnering on organizations, with organizations on SNAP outreach efforts, looking at providing food pantry visitors with assistance in enrolling in SNAP, advocating for ways to simplify the application and recertification process. And also just, again, further research into what are those barriers that are preventing people from applying for SNAP in the first place, or in the recertification process, where are they getting caught? What is that misinformation we might need to address? What are the, physical application design? How can we improve it? Things like that. So I am going to turn it over, I think, to Sarah now to introduce our panelists.
Hey everybody, I'm Sarah Garcia. Is this,
That's our clicker.
oh, it's a clicker, okay, I don't need to click anything. At least I hope not. I'm Sarah Garcia. I work with all the diverse religious communities that support the DMARC Food Pantry Network. And we firmly believe that working together is a really important part of addressing big problems. And because our data is just part of a much bigger story, we want to invite up our panelists who are going to share a little bit their perspectives, what's happening in the community from their services. So come on up.
Lord, that is exactly what I didn't want.
All right, so we do have a mic situation here. The mics are a little hard to use, so if you want to use it, flip up the switch. You do have to speak pretty close to the mic. But we're going to ask all of our panelists to introduce themselves and tell us what your program is and just a little bit about your work. Zuli, would you start?
Hello, everyone. Sorry about my allergy. I'm Zuli Garcia, founder of Knock and Drop Iowa, which is a culturally specific Latino food pantry. We service anywhere between 250 and 300 families in a 2-hour period. We started on March 24th of 2020 during the pandemic because we were getting phone calls from families that knew how to pay their rent, had money to pay their rent and bills, but didn't know how to feed their family. They didn't know what they were going to do. So it started out of my garage, and then finally I got a space, and I'm able to service 250 to 300, and I'm very proud of that because we service culturally specific foods, which means, first of all, hands up, how many of you like pupusas, tortillas, tamales, right? And then you go to those Mexican restaurants and your kids like the cheap dip, right? The chip. So if you all love our food, what makes you think we don't love our food? And that's why you have to think outside the box. And that's what we do.
Hi there, I'm Ashley Ezzio. I'm a senior project coordinator for UpLift, the Central Iowa Basic Income Pilot. Raise the hands who's heard of us. Oh my gosh, I say my name. UpLift, if you haven't heard of us, is the first demonstration of basic income here in Central Iowa. We're brought together by an 11-member funding group, which includes corporate, public, private, and philanthropic dollars, really to address the cause of poverty. And basic income was a promising practice And so together with my colleague, Michael Berger, we'll shout out there, we make up the project coordination team responsible for really engaging the community and taking care of our intervention group participants. So back in February of 2022, we opened an application for eligible Central Iowans to apply to be a part of our research study. Individuals needed to be 18 years or older, live with a dependent up to the age of 25, live in Polk, Dallas, or Warren County, and have an income at or below 60% the area median income. We received 6,000 eligible applications, which shows a huge need in our community. And from that pool, we selected 110 individuals to receive a $500 monthly stipend for 24 months. We have 140 individuals in our control group to serve as a comparison. And we're about 18 months into payments now. So we're really excited to share what we find in this research study with our community. Yeah.
Make sure we're accessible. Okay, good afternoon, everyone. My name is Audrey Kennis. I go by she, her pronouns. I am the Director of Human Services and Inclusion as of the first, so this is new. I've worked for the city of West Des Moines now for about 3 years. I think yesterday was my anniversary, and like I said, I just recently merged with Human Services. Now, we have been in the city for almost 50 years, since 1979, so we've been around for about 46 years. And we're the only city in the state that has a human services program, a department, a whole building that is completely, again, committed to trying to serve the needs of our most marginalized resource residents. One thing I will say I'm really proud of, again, this is equity in practice. I say that is so critically important when I first came to the city. And I think it's something we really have to take pride in, is that we've always showed up to try to meet the needs of our residents. Yeah, I'm excited for today's conversation.
Hi, everyone. My name is Shannon Draayer. I serve as Executive Director over our Community Nutrition Services through WesleyLife. WesleyLife is a nonprofit based in the Des Moines area serving older adults in various ways, including many services for those who live at home. Our mission is to help keep people healthy and independent at home, and our Meals on Wheels service, which I support and oversee, is a critical part of that. Our survey data shows that 95% of those we serve were able to stay healthy and independent at home through Meals on Wheels. And we're really happy to be here today to shed a light on what seniors are facing or older adults are facing for food insecurity that ties into other barriers they have to access services in our community.
Hello, I am Lynn Wilson, formerly Marchant, so some of you may know me of my previous name. I work for Des Moines Public Schools, and I am the district liaison. This is a new role for me that just started in January, which really aligned better with the work that I was actually doing. I encompass the homeless liaison role. I work with our migratory education programs and our foundational services. So as the first community school coordinator about 16 years ago, so I was the OG. So going back to that time, we've really tried to serve families in the school and make that a one-stop shop and put our services in a location that is safe and comfortable for families to be able to access. So serving over 30,000 students in our Des Moines Public Schools, we are the most diverse district in the state of Iowa, and our needs are very high. We currently have about 7,000 ELL students, and those are the ones that are qualifying for ELL programs. That doesn't mean that that's our only diverse population that's in the district. We are currently a white minority district, and things change every single day. New families are coming every single day, and we're doing our best to serve them in all of our different components of programming. It's my role under our foundational services to supervise the medical and dental clinics that we have within our schools and our partnership with the Food Bank of Iowa and other foundational services that we're trying to get into our sites.
So Lynn, we'll start with you again. And so we've been talking about the population we serve and some of the things that the general public might not be aware of. So share just a little bit more about who are the people that you assist and what is something that the general public might be surprised to learn?
I think we assist everybody. Really the food bank program that we have within our schools, we're in every single school across the district, I think, except for one, which we're working towards right now. And that includes our preschool programs, all of our district-wide programs. So we have a wide variety of folks that we're reaching out to. Running a pantry myself actually still allows me to see who's coming. And I think it really is different by the neighborhood that you're in. So all of our pantries are meeting the needs of that population that lives within that general community. Having so many different locations, every building is different. Every neighborhood is different. So I think that's what we see just across the district is that wide variety and diversity of people. Currently, the need is very high. I think last year we served 1.5 million pounds of food went out to families in our school pantries. So the need is high. I think that's changed dramatically over the last few years with our housing crisis. Our homeless numbers that we see currently are about 550, and it's only September. By the end of the last 2 years, I've been right at about 1,200. So those numbers have increased since COVID. We've gotten better at recognizing and doing what we really should do for families. So we're better at it, but that also increases the numbers. So I just think the needs financially are high. Our mobile families working with the migratory education program as I do, we had about 500 people that are children that qualified last year for migratory education programming. And that means that they're working in agricultural kind of careers and are moving regularly and mobile. So we're seeing such need because of the financial need, because of the housing and the lack of resources that we have in those areas for it.
Yeah, and Lynn, I think that would be really surprising for a lot of folks in this city to realize is that you have young people, you've got students who are migratory workers, and their families are, that is part of their story, but then also that the number of homeless students that you have in your district is significant, and then it grows throughout the year. When you said 1,200 by the end of the year, does that just count the students?
Yes, that's just the students that we have. That doesn't include the family members. Just to give a little picture, we had a small school district that we were working with on a family, and they didn't realize that we had at the time 1,200 homeless kids. They have 600 kids in their district and had 4 homeless children. So they were wondering why in the world we needed them to be able to support those kids instead of us trying to figure out how we got them here from an hour and a half away, and why it was in the students' best interest to go to school in that community and not have to ride a yellow bus for an hour and a half before and after school. Looking at that, I wouldn't do that for my children. I don't want that for anyone else's children.
All right.
Okay, I can share a little bit about our Meals on Wheels folks that we serve. Every day we're making about 2,000 meals from scratch, starting quite early in the morning to get those meals out for lunch. Typically serving those who are over 65. We do serve those with disabilities and veterans of all ages. And we have expanded our campus recently. I think many of you have come to see us as we've expanded to grow to meet the need. I think some things that might be kind of different or unique about us compared to some of this data, I think the point about the 46% only came once or twice is really interesting and critical. We're more of a steady service. Many people stay on our service or receive our service for many years. Their incomes are fixed, so their situation isn't dramatically changing. We're not a one-stop shop or one-time stop, I guess. I just looked up data last week. Our longest served client has been with us since 1999, which is amazing. Like 25 years of serving her on Meals on Wheels. We do trend more female. That mirrors some of your data as well. The average age of our client is 76. I think the other thing that might surprise folks is, of course, the nutrition is so critical, but as you might imagine, we're serving an isolated population that is often forgotten. About 70% of those we serve live alone. And so the nutrition is so important, but we need to ensure that folks are eating that meal. So we're visiting them with a smile from a friend. They really get to know their driver and build that social connection through Meals on Wheels. And often they're managing chronic conditions. So if you have sort of early onset Alzheimer's or memory loss, you may be forgetting to eat unless that meal is brought to your door. You see that friend, the meal is warm, you're ready to eat it. And so it's an important part of nutrition for those who are managing complex conditions as well.
Again, one thing I'll say about Western One, I think there's often a perception that, again, is primarily white and affluent. The clients that we serve look very different, as we've seen on that graph earlier. About 7% of our residents in West Des Moines have utilized our food pantry in the past year, which is pretty high. And of that, 30% were first-time users. So we see the same similar shift that you all were mentioning earlier. Another interesting caveat: 70% of clients who utilized our free medical clinic were first-time users as well. They were new to the clinic, so we're seeing these spikes across. And that's one thing I would say is really great about our agency. We do food pantry. We have a clothing closet. We have a free medical clinic. We also offer emergency financial assistance, which is again very rare and unique. We offer ELL classes on site, and so we try to give comprehensive services to meet the needs of our residents to be able to help them make some of that social mobility. But again, as we're looking at the demographics and the breakdown of who's coming in, again, a lot of new Iowans and new folks come into the pantry for the first time. A lot of folks utilizing the clinic for the first time. A lot of folks who are uninsured or underinsured. And so this is really pushing us to try to reevaluate how do we help better understand the profile of our clients and connect them to the services that they need.
So we only have 110 individuals that are currently receiving a $500 stipend. But we kind of mimic some of these. So the average age for the UpLift participant is 37. 85% of our participants are female. We also see that the average family size is 4 with an average of 2 children, but household income is at about $24,000 on average. And so I think there's a lot of diversity within our pool that represents our central Iowa kind of community. Racially, we see about 55% of these participants identifying as white. We've got 26% as African American or Black, 4.5% as Asian or Latino, Latinx, and then about another 10% as multiracial. And we also see a high number of single parents in this. About 63% of UpLift participants are single parents. And then another statistic I kind of like to give you a picture of is receiving public benefits. So we were at 60% of area median income, which is about 250% of federal poverty line, close to ALICE survival budget there, but 76% are receiving public benefits of some kind upon application of UpLift. We do give all of our participants a survey every 6 months to kind of see what's going on in their lives related to physical health, mental health, how their kids are showing up at school, employment status, housing. And so we'll see what that looks like over the course of the 24 months they receive payments. And we'll do one post-intervention survey to see what does this look like 6 months after payments end. We're excited to have those results summer of 2026.
We open our doors to everyone, but we are focused more on Latino. Everything is in Spanish because we want to make sure that it's a welcoming place where people can feel safe and they can ask the appropriate questions that they need answered. Not only are we doing food insecurity, but we've also added, we do health screenings. We do COVID and flu vaccines. I do cervical cancer checks in Spanish. So it's that one-stop shop, like you guys were saying. It's a huge need. And Matt and I have talked about this. We definitely need that here because we're pulling people in so many different directions to the point where some of our families may be coming from a domestic violence situation, right? But if there's a language barrier, there's food issues, there's money issues, there's transportation issues, mom has to decide, okay, now I have to be pulled in all these different directions to be able to get the assistance. Or do I go back to the abuser that takes care of everything? So we're really trying to bring a one-stop shop where people can feel safe and welcome and they can actually express and find the needs that they're looking for. And that's why we focus so much on the Latino community because the language barrier is a huge barrier. Many of you are amazing and you guys want to help, but it's very scary as a Latino to come and say, I need help and assistance. Why? Because they have to use their children to translate or interpret the documents, right? Why? Because I need to come forward to someone that's white and say, I'm in this bad situation. What are you going to do for me? Are you going to turn me away? Or are you going to say no to me? So we try to make it, and some of you have been there, where we have music going on. It's not just, a food pantry where you just go and get the food. No, we have music in the background, Spanish music going on. Everyone smiles, and I think that's one of the things that they said is, you treat everyone with respect and you give the stuff with a smile. And you help them at where their essential need is at, and you bring other services. So that's what.
So with the DMARC Food Pantry Network, we know that food insecurity is a sign of other problems, other challenges that folks are facing that are putting pressure on the families. And as you get to know folks, working with them, developing that relationship, people start to share about some of those other pressures in their lives that are pushing them to need your assistance. What are some of the pressures that you're hearing about from folks that you are assisting?
There's a list. But I will tell you the most recent one that we had that I thought, I don't have children, so I don't know how that works. But I had a mother that came to me asking for Similac formula because we get a grant so we can buy some baby formula. And I said, well, was your, no offense, not my problem, but was your baby born here? And she said, yeah. So why isn't WIC helping yours and not Vaseline? She said, I've already told them that the baby is allergic to Enfamil and I have to give the baby Similac. And I said, okay. And what did they say? Well, that's what we provide is Enfamil. Okay. So thankfully I had someone there that worked at primary healthcare and I said, hey, can you come help me? Because I know there's gotta be something here that we can do. I just don't know the spot. I don't know everything, right? But people feel comfortable telling me. So she's like, no, we need to go back to the doctor and say the baby's allergic to Enfamil. They need to write a note, send it to WIC, and then that way they will switch your baby formula. That lady started crying right there and because she was going through food insecurity. She was obviously at home with this baby now, right? She's a single mother struggling. She doesn't know how she's going to keep providing Similac formula except coming to us and requesting it. So she didn't know she was running out and how am I going to serve my kids? So that's, you know, a slight story that I can tell you that makes a difference when we create a safe space. And those are the barriers. And it's something that we would know how to fix, right? We would ask questions and we would advocate. And at the end of the day, I'd be like, look, my child can't drink that. You need to give me a different one. But people, when there's a language barrier, they don't know what to say. But if they're saying that's all we give you, okay, that's all you give me. I guess I can't ask for more. So that's a big one for me.
So UpLift is a little different than all of these direct service providers that are doing really hard work. But I will say that we involved them in the planning process of UpLift. We came and we said, what does our community need in order to engage with UpLift and trust that $500 a month is not a scam? And we listened. And so we had outreach materials in 9 different languages. We worked with every step to provide interpretation services at some outreach events. In just 5 interpreters brought over 15 languages. So we would go to public libraries to provide folks with just access to services they needed so that their name was put forward as well. We also talked to our domestic violence advocates and really put in some parameters to make sure that this income went to one person. It could remain private if needed. We also provided cell phones. That was feedback that we got. If folks are going to be engaged in a survey, they need to have reliable ways to communicate with you. So we've provided cell phones to other intervention and control groups so that they can participate in those surveys. A lot of our data is not there yet, but anecdotally, we have talked to participants who struggle even with receiving $500 a month. With food insecurity, we have some that are still going to a food pantry, but it is opening up a lot of other opportunities. We have tons of entrepreneurs that are coming out of this and giving back and serving their community there. And so if you're interested, we also have a storytelling panel where some of our participants shared their direct stories related to what a basic income has done for them. It's on our website at upliftiowa.org. If you're interested, we can hear directly from their mouths some of their challenges and also some of their successes that they're having in relation to the project.
If you haven't seen it, you need to see that.
Again, as I hear me? Can you hear me? Okay, it's fine. So as I mentioned earlier, again, we have the privilege of also providing emergency financial assistance. So a lot of the inquiries, the applications we receive are related to some type of emergency or extenuating circumstance. Generally, it's related to housing. And that's where we're seeing a lot of needs that are people are cost burdened, right? It's just a reality. Inflation is a challenge impacting housing, impacting food prices. All of this is pushing people to come up to our doors every day. And so we're seeing hundreds of applications every year, and every situation is very unique. So that, again, similar to what you all talked about, again, there is no typical person that showed up at our human services door. However, I will say a lot of the issues we're seeing is people are struggling to just be able to cover the rent, right? Because they're making other decisions. I'm covering medical bills, right? Or I'm trying to pay for food. And so they're trying to sacrifice to try to balance to be able to cover their resources. And so it's really interesting just to try to figure out how we can help folks creatively come up with some solutions. And again, it's never easy, but one of our biggest, I would say, benefit is being able to have that emergency financial assistance be one of those levers that we can pull to help folks when they are struggling and they're showing up for food. But then we can address some of those other concerns that are happening and try to be able to, again, holistically look at their needs.
I think a lot of the external pressures have been discussed by this group. A couple of things that I want to highlight, I think that we're watching really closely, maybe some of you are aware of or will become more aware of. But the rise in chronic conditions and the rise in the aging population are two really critical things for us to keep our eye on. About 80% of older adults have at least 2 or so chronic conditions, maybe more, that they're managing. And so we all out in the world have to make decisions about that too. What are we choosing off the menu? Are we reading labels? I'm so glad that you guys are considering quality and what we're putting in our food pantries. So that is driving a lot of our choices around menu design and what that might look like next year, 3 years, 5 years. We're going to need to be offering a wider variety of diets and prepared meals that we make. And so we've been doing a lot of work and thinking around that, just the number of chronic conditions that people are managing. And then the population is aging. I don't know if that's a surprise to anyone in this room, but the number of 85 plus in the state of Iowa is going to grow 90% by 2040. There was just an article, I think in late July, in Axios about our area here in Des Moines and Polk County. It was 11% increase in those over 65 over the last 3 years or over a 3-year period. I think the data looks back a little bit farther. It was 2020 to 2023 was the data that they were referencing. But we have expanded our operations and are trying to grow to meet the need, not only because our dollars are stretched farther, but there are more and more older adults who are going to need this type of service. And so how we might serve them in the best way based on their chronic condition, their living situation, and all the needs in their life. We're trying to adapt our service to be ready for this sort of silver tsunami that's coming our way. It's an industry term.
If you haven't heard about education, like everything's really a struggle. Being underfunded, it's hard right now. So we're really facing a lot of our needs and getting those gaps met through our community partners. So thank you. The big piece I think that we're looking at right now is attendance. We can't serve a kid services and supports. We can't serve a kid educationally if they're not attending. The state currently, with their new Senate file, we're having to go back through and revamp all of what we're doing with attendance and how we intervene with that. What they don't understand is a large part of our population is new to the country. They don't know what the American education system is like. It's very, very different. Many of our young people have never been to school before, but now we're expecting them to sit there from 8 a.m. until 3:30 in the afternoon and be educated. So really trying to tailor education to what the individual needs are and really get parents on board to support that process and to get kids in the seats. That's really what the goals are at this point, to be able to do for our families.
So as we wrap up our panel, I wanted you each to share a challenge that your program faces in providing your services and an opportunity that you see. So let's end on a positive note. Lynn, do you want to start?
Sure. I think one of the biggest challenges is our mobility of our families. And they're moving from school to school across our district. They go to an outside district and then come back. But really trying to stay abreast of that and engage those parents. That's the challenge. The things that I think looking forward to and having an opportunity to touch is volunteering in our schools. You know, if you can be involved in a food pantry, if you can be involved to read with a child, we really need your support to be able to do those things. And we have hope. We have so many kids, and we're reimagining schools right now. And I feel like there's going to be a lot of great changes coming to one.
I think one of the challenges, I guess I probably can't say funding, can we say funding across the board, everybody? Funding challenges, of course. I mentioned like we're going to need to meet a diversity of interests and diets. And I think we're kind of thinking about that related to heart healthy meals and low sodium and renal diets and different things that folks are going to need who are dealing with these chronic conditions. Yet we also will have to expand our services to meet a population that may want a different style of food, a culturally appropriate food. Just how many items can really be on our menu? And when is that sort of trigger point where people need a prepared meal or a box brought to their door? What's sort of the balance of providing people pantry or stock items versus prepared meals? And how could we grow our menu to meet all those diverse needs, or at least as many as we can? So that's a challenge that we're facing. I think my hope is just in the people that make the magic happen every day in our world, the volunteers and our paid drivers who greet these folks truly to build a friendship. I mean, it just blows my mind, the relationships that are built between the individual and our driver. And that happens through a human touch. And you're doing it through dignity at pantries and in schools in all sorts of different ways. But every time we're doing this outreach, it is, a human to a human, helping them and bringing joy to their day. So that I think is what I guess keeps me going or brings me hope.
So I would say one of the challenges is just capacity. We keep talking about it. It's just, again, we're seeing record over record numbers come through our doors every day. And so just trying to work with our team to be able to scale up, I think is one of the biggest challenges for me, and really just looking at process improvement, how to be more efficient, and really trying to project out. So not looking at what's happening right now solely, but really thinking about 5-10 years later. And how do we start preparing and planning for that? I would say is really big. The other is the benefits cliff. That's just a real challenge that we're seeing. And so we have a lot of folks who go to our doors who are employed, right? But they're underemployed, right? They cannot afford to be able to maintain the lifestyle that they're living with the increase, again, in inflation and food and housing and all these other issues. So really trying to work with, elected folks, I would say with my city and our leadership to really understand the need. We are funded by grants, donors, partnerships, right? And so everything we provide is in kind, more or less. And so to be able to see how much people do care about these issues, they just don't always know about how they can help solve the problem. And so really trying to encourage our entire community to band together, roll up our sleeves, and everyone take action. So we cannot be complacent, we cannot sit on the sidelines. We are in a crisis. And so everybody has a responsibility, and really just trying to share that message with all the folks who are the decision makers. They do have the power to make some of the policy decisions that can enact real change.
So while we are incredibly proud to be bringing forth Central Iowa data, 110 folks when we had 6,000 apply, I think is just kind of a bummer, right? There's more need out there, but we do hope that our data is used to move forth effective policies and programs to really be innovative and start to use our social safety net or whatever that is to really address the needs. I think what's really inspiring us is Michael and I have hosted a bunch of community conversations, and within that we hosted book clubs throughout the Tri-County area, truly throughout the state, really looking at Matthew Desmond's work with Poverty by America and Evicted. And those book clubs, folks showed out. Community members came and they said, we want to talk about the hard things. We want to talk about poverty, and we want to know what we can do to get involved. And I think that was just one thing that keeps you going, knowing that folks care and they want to dig into something as complex as all of these issues we're talking about. So I'm really excited to be able to give data to back that action.
I agree. Funding, capacity. I'm a one-man team, one-lady team. I'm pulled in many different directions. I have an amazing group of 25 volunteers, but as you all know, it can't continue running on volunteer basis, right? So I'm really looking into that and hoping that we can get something in the future. But for me, the hope is that Knock and Drop arrived March 24th of 2020, and it's here to stay. and it's making a change in a community that was in the shadows, in a community that was very much scared, in a community that I had children tell me before we met you, we were eating our cereal with water. And you live in the United States, how can a child eat their cereal with water? So for me, that's the hope, is that Knock and Drop is here to stay. Knock and Drop is making an amazing change in our community. It's empowering Latinos to step up and say, you know, and advocate for themselves and understand that we have allies out there. It's just you're scared because you don't know them, but if you come together, you will get to know, because I have many allies sitting here right now. And if it wasn't for many of them here, especially one person, which is that lady in the back, Audrey, I would give a huge shout out to her, because Knock and Drop wouldn't exist. She told me, you're already doing the work, you're just not realizing it. And that is the reason why we're here. She came in and actually opened many doors for Knock and Drop. As a Latina, it was hard, man. People didn't want to give us money. People were like, what are you doing? Why do you need that? So it was amazing that she actually took the time and went and introduced me to many of you that are here now, that are now my allies. And I thank you for that. So that is a huge hope for me, and I'm very blessed for that.
So thank you all for being such important allies and advocates and partners in the work of helping our neighbors, because we all serve our communities in different ways and we learn so much from each other. So let's thank all of our panelists. And we're going to keep them up here for a few more minutes, and we're going to open it up for questions from the community, and there might be some questions coming from online too. Bridget.
I guess I have a lot of questions, but I just want to thank you all, everyone in this room, for the amazing work that you do. We are, as you all know, we are all struggling as a community right now. I am on the Urbandale City Council, and I also am the Urbandale representative for the DART Commission. And I feel I would be remiss if I didn't talk about what's going on at DART in the presence of this group, because as you all told us, many of the people that are using our pantries are employed. And there is a lot of problems at DART right now. Our communities are fighting, and I feel like we are on the verge of an existential crisis. And that won't help any of the work that we're doing. So I don't want to add, you know, more misery to what we're talking about today. But it's really important, because you guys are the ones in this room that are doing the work and doing the advocacy. And I know I'm one of the few people on the commission that is speaking for the riders, I feel, and not about taxes and tax rates and things like that. And it's really the suburbs that are pushing back against Des Moines right now. And so I know your plates are all very, very full, but please pay attention to what's going on. And if you're in Des Moines, tell your city council members how important it is that DART continue to exist, paratransit continues to exist for your clients. And the suburbs, I think they understand the need, but they also have to, you know, figure out how to. We have such few routes in the suburbs that how to make it work. And so we're just at a really difficult time with this right now. And I just want to point this out, because this is all going to be happening over the next 60 days. And I don't know if we've reached a point of, I don't know if we're going to be able to come back. I mean, we're not quite there yet, but I just, with this room full of doers, and people that make things happen, I feel like I have to tell you very from the bottom of my heart how significant what is happening. I mean, we provide service to thousands of DMPS students. Yes, it's paid for by DMPS, but if there's no DART, there's no additional busing provided, you know, paratransit. So, you know, West Des Moines is one of our biggest, you know, just, please pay attention, advocate to your local officials, Polk County, your cities, and, because it will just make things worse. And, your boss, Russ Trimble, is our chair. And one of the things that he says that I really think is true, you know, that we all know the parable about, you know, teaching a man to fish. And, you know, Dart gets the man to the pier so that they can fish. And so, I try to, you know, it's a moral obligation for me, but, not everybody feels that way. So sorry to be a downer. Thank you all for the work that you're doing, but please, please, please pay attention and advocate as much as you can add that to your plate.
Transportation is one of the important pieces for bringing together people with services, but also people with opportunities so that they don't need the services. And that is an area in our community that seems to be under a lot of challenge and pressure. Other questions?
Sorry about
That's
that.
okay. Thank you. No, it's a really important piece of the conversation.
What can community members and partners do to activate, make sure that in case of DART or in cases of public assistance funding being increased, what can we do to help support that to actually start really getting going?
What can community members do? Let's all take a crack at that.
Obviously, like she said, you know, make sure you talk to your local representatives, obviously your state representatives. You know, making sure that you're speaking up for the people that don't speak up, right? Because there's either a language barrier or they don't know how that works. Some of us know how that works, and using your networks that you have. Because sometimes, you know, I may know Sarah, but you may not know her, and she's in a place where she can probably take that up there. So network within your area to see who's connected with who and who you can utilize to make the changes that are needed, not just in the city, but in the state, as Matt was saying, because we rejected funds that were an essential need. And the fact that the answer was because children were obese, it is not true. There's no, that was not the response that we should have received. It is when you're hearing a child saying they're eating their cereal with water, they're not obese, they're struggling. And these parents are hardworking individuals, single mothers or single fathers, like the Moines Public Schools does, because I help them with translation sometimes. And they're trying to make ends meet, but they're having to decide, do I go to work? Do I pay bills? Do I take them to the doctor? Do they get vaccine, or do I buy food? There should be no reason why you should have to think that way. So networking is one of your biggest things, and making those changes, speaking up for the people that can't.
Gonna make a couple of selfish plugs here. Use our data. UpLift has spending data from our participants. 42% of this is going towards food and groceries. That's followed by 26% of retail, which includes Walmart, Target, Sam's, where we know people are getting lots of things they get at food pantries, toilet paper, toothpaste, right? And then transportation is number 3 on our list, which is different than what we see across the nation. So use the data that's out there to really inform the decisions and things you're talking about. And then also, we put out a public benefits 101, being educated about all of the services and benefits that are out there, how they work, how they're funded, and how they're being utilized. I think that's a really key tool to be used now.
So I would say, you know, I think first, thank you all for putting this together, because I think this is a space where really you're able to come together and converge and try to come up with some ideas or idea of what we can do collectively. That's the only way we can address this issues. I would say the other is really showing up at your council, city council. And I can't stress that enough. No, I may have to go, but I will tell you, those who are showing up, the things that we're discussing are not related to what we're talking about today. And that's the problem. And so there is a huge disconnect between the people who are making the decisions about our lives on a day-to-day basis and the people whose needs really need to be heard. And so I think these conversations, I would say, I think this needs to be at a city council meeting and maybe let's set up something, we go around all the suburbs and the cities, just to have an executive session to say, this is what's happening in our community. Done a phenomenal job putting together the data. You're helping tell the story. Now we need folks who need to understand what's happening, have a clear understanding of that. So I would say you all show up at those city council meetings. So I'm listening to a lot of things that are not really relevant, are critical, are going to address the crisis that we're seeing in our community right now. And that probably is the most effective way. That's where those decisions are being made.
I'll put an exclamation point on that as a city council member. And, you know, and we have another, a statewide or state elected official here holding a microphone. And, you know, that those decisions also, you know, the elected officials absolutely need to hear from people. But, you know, in the discussions in the community about DART, there are communities that are represented here in this room today that do not understand that there are needs in their communities. And I said, look at your schools. Every single one of our school districts is seeing dramatic increases in English language learners and free and reduced lunch. And for those city council members to say, oh no, we don't, you know, we don't need DART, you know, we don't need to get people to their jobs. So yes, please come to your city council meetings and the state house though. Yeah.
I want to yes and that also. So obviously, if you're here today, you came because you're a person who wants to be, likes to be, needs to be informed. But you have to be an informer too. Because to Audrey's point, when I come to a city council meeting, they know exactly what I'm going to tell them. They know exactly what they're going to hear and how the conversation is going to go. It's when people outside of the DMARC world come and say the same things, that this is what we're seeing. So it's so important to be informed, and you have to keep getting opportunities to learn more information about what's going on. But then you have to become an informer too, not just like Snow, for those of you who are about it.
Yeah, I think that's critical. During the food insecurity work group, we talked a lot about storytelling. Of course, the data is so important and a lot of them to just throw numbers at people, but tell the stories of the people that you're seeing in your work. And just a plug from direct service organizations up here, please volunteer. I think there's a lot of nonprofit folks in the room, or folks who are already spending much of your time on this. And so maybe there's people in your life who work for a local corporation and have things like BTO or time to volunteer. Spreading the word among our corporate friends and others who can give a little bit of their time throughout their workday to do even just a couple hours of direct service to support folks. We always need volunteers. So that would be my little call to action. If you can, come volunteer with us.
I just think that the thing that surfaces in my mind is to be the change. I think I am involved in so many things, kind of like Matt is saying, they know exactly what we're going to say. And I think we get complacent sometimes and think that the guy behind us is going to have that conversation and be that change maker. But it needs to be all of us, not just those of us here, but everybody that we know in our community needs to be part of that change. We can't do it without.
And I would like to encourage folks, if you're working with a population that is struggling, that is experiencing challenges, help them to tell their stories, help them to connect with their elected leaders at all the different levels, because it seems kind of impossible for folks, and often government feels very far away. But look, we've got the city council right there, state elected leaders, they're everywhere. I mean, you know, so you can talk to them, and when you share your stories and perspectives with them, those things do stick and they do make a difference. And I think a lot of folks who are struggling don't realize that their voice is really important and their story really does matter. They just need some help in knowing how to share it. So the storytelling piece is really important, but so many of our neighbors have no idea who their elected leaders are. They might know who's at the top of the ticket this fall, but then down the line it gets pretty hazy. And so we could all be more engaged citizens, and a lot of our neighbors and the folks we encounter on a day-to-day basis too. And remember, we have an election coming up this fall. It's a good time to be talking to the folks who might be on the ballot about where they stand and make sure that they're hearing your concerns. Other thoughts or questions? Well, Matt, are you going to be wrapping things up here?
I certainly can.
Right. Well, thank you all again, panelists.
Mostly, I just want to thank you all for taking time out of your day to come and try and get a better understanding of what those folks were seeing or experiencing, understanding our community better, and then challenge you to don't let this be the only thing you do. Find more opportunities for more spaces like this, turn additional pieces that you may or may not know, or just dive deeper into something you think you know. And like I said, don't just get informed, but become an informer too. So can't thank you enough for all you all do across our community and our state and the partnerships that we enjoy in this room. So again, thank you all for being here. If you want a snack, got some snacks in the back. And until then we meet again, don't let it be too long.